Hello, everyone, and welcome to today's webinar in the Public Health Webinar Series on Blood Disorders. This webinar is presented by the Division of Blood Disorders at the U.S. Centers for Disease Control and Prevention, also known as CDC. I'm Vanessa Byams, and I'm the lead health scientist in the Division of Blood Disorders at CDC. I'm delighted to be here with you and serve as today's moderator. I'm pleased to introduce my colleagues joining me today who I've had the pleasure of working with over the years in their roles as regional leaders of the U.S. Hemophilia Treatment Center Network. Susan Lattimore is the Associate Director at the Hemostasis and Thrombosis Center at Oregon Health and Science University. She serves as the Regional Director for the Mountain States Hemophilia Network. Her primary interest is in public health and research initiatives for people with bleeding and clotting disorders. Kaveh Shabtai serves as the Regional Administrator for Region 5 West, Northern States. He has more than 13 years of experience in healthcare settings, and his areas of expertise include grant management, database management, research study coordination, program funding, financial management, and analysis. Kaveh received his Bachelor of Arts in Biology, Society, and the Environment at the University of Minnesota and completed a Master of Public Health and Health Management and Policy at Drexel University. Susan and Kaveh will provide you with a high-level overview on the findings from the third National Hemophilia Treatment Center Patient Satisfaction Survey. Before we begin, I'd like to go over a few helpful points for joining this webinar. Upon joining the webinar, you will see two audio options. You can opt to listen via the speakers on your computer or by using your phone to call in. If the phone option is chosen, the webinar toolbar will provide you with the phone and access number and audio pin. All audio will be muted. At the end of the presentation, there will be time for questions. To submit a written question, please use the questions area of your toolbar. The presenters will respond to as many questions as time allows. Today's webinar will be approximately 1 hour. Please note that the webinar will be recorded and posted. We will begin today's webinar first with two brief audience polls. We want to learn a little bit more about all of you, our audience members. So we'll go ahead and launch the first poll question. Which best describes you? Please give us some information about your professional affiliation. We'll give it a few more seconds to make sure that we give everybody a chance to respond. All right, let's see our results. We have 44% healthcare providers, also some public health professionals, and thank you to all of you joining us today. All right, we will go to the next question where we want to know where you're from. Where in the world are you from? And so that question will launch. Which region of the world are you from? All right, let's see. Overwhelmingly from North America, but we do have some visitors joining us from other regions. So again, welcome everybody. And it is my pleasure to turn it over to Susan.
Thanks, Vanessa. On behalf of myself and my co-presenter, Kaveh Shabtai, we would like to thank the CDC Division of Blood Disorders for inviting us to speak. Thank you to the Hemophilia Federation of America for hosting this webinar, and we have no conflicts of interest to disclose. I just want to start by saying today, December 1st, is World AIDS Day. We'd like to spend a moment of reflection to acknowledge the impact HIV and AIDS has had on the bleeding disorders community. Thank you. Here are our learning objectives for our talk today. We'll be discussing the United States Hemophilia Treatment Center Patient Satisfaction Survey. Our learning objectives are listed here. This webinar will be broken into 4 sections. The first section is some information on the patient satisfaction survey background and generation of the survey contents, and other pieces of the survey itself. The second section will be focused on the 2021 survey results. The third section will be focused on survey trends over time. And the last section, we'll talk about next steps for the survey. Next slide, please. So why seek patient-reported satisfaction? Patient satisfaction with healthcare services is a key way to measure patient-perceived quality. Patient-perceived quality of care helps us hear from patients and caregivers who are receiving care at treatment centers, and we can learn what HTCs are doing well and where hemophilia treatment centers can improve to better meet patient needs. Hemophilia treatment centers provide team-based comprehensive care, including a physician, nurse, social worker, and physical therapist as members of the core team. This comprehensive care model is recommended in national and international guidelines for the management of individuals with bleeding disorders. The patient satisfaction survey lets patients and caregivers share how satisfied they are with the care received and with team members. A nationally uniform survey is important. This allows us to report on the entire US HTC network while diving deeper into regional and individual HTC similarities and differences. All HTCs can participate in the survey administration. Conducting the survey every few years helps us understand how satisfaction is changing over time. And then we can also understand in which groups are things changing. Is it in some groups? Is it in all groups? Or parts of the country? Is satisfaction rising or falling or staying the same? And these trends over time can help shine a light on where to focus quality improvement efforts. The patient satisfaction survey results are helpful for advocacy with payers, government partners, and with hospitals or healthcare institutions of HTCs. Finally, the patient satisfaction survey helps hemophilia treatment centers report on government and grant objectives such as adolescent to adult transition, patient engagement in care, shared decision-making, and access to care. Next slide, please. Research has shown that links between patient satisfaction and health outcomes exist. High levels of patient satisfaction are associated with better health. You can go back to the next slide. Positive interactions between patients and healthcare providers increases shared decision-making and satisfaction overall. And patient satisfaction increases treatment adherence and can also improve overall health. Next slide, please. So this will show you a little bit about how the patient satisfaction survey is organized. A harmonized patient satisfaction survey was created in 2014 and administered for the first time in 2015 across US hemophilia treatment centers. A steering committee led this work, basing the survey on satisfaction surveys and other complex medical conditions. A steering committee continues to spearhead these efforts and is comprised of regional treatment center leaders and members of the Hemophilia and Thrombosis Center at the University of Colorado, which serves as the data coordinating center. A dissemination work group provides advisement to the steering committee and helps us understand how to best release information about the survey and where there might be areas that we can improve. Regional administrators are key in engaging hemophilia treatment centers and disseminating survey information, survey documents, and data. HTC staff receive survey documents at each survey administration and prepare the survey for distribution to key patients. The HTC patient satisfaction survey is voluntary. There's no dedicated funding that supports the administration of this survey, and HTCs aren't required to participate, although all are encouraged. To date, the patient satisfaction survey, you can go back one slide, has been administered 3 times, in spring 2015, in 2018, and in 2021. The survey is distributed to individuals with a bleeding disorder who had 2-way contact with the hemophilia treatment center in the prior year. The survey is available online and in paper forms, and it's available in English and Spanish languages. Next slide, please. So what are we asking on these survey questions? Demographic questions capture general information about the individual or patient for whom the survey is completed. You can see most of those on the right-hand side of this slide. Satisfaction questions address overall satisfaction with care received at the treatment center, as well as satisfaction with specific hemophilia treatment center team members, services, and care processes. A question example is, how would you rate your level of satisfaction with the HTC staff in 2020? Always satisfied, usually satisfied, sometimes satisfied, never satisfied, or not applicable. For teenage patients ages 12 to 17, questions regarding satisfaction with transition to adulthood, like how to care for your bleeding disorder as an adult, and HTCs encouraging you to independently manage your bleeding disorder are also included. Questions regarding barriers to care, for example, how often was insurance a problem in getting the services you need, were asked. We had two areas where we added questions in the last iteration, which was 2020, based on care received in 2020 and administered in 2021. Those questions incorporated questions regarding telehealth or video visits and whether COVID was a barrier or a problem in receiving care. At the end of the survey, there's an area for any open-ended questions or comments that patients and families feel like they want to contribute to the survey. I'm going to hand it over to Kaveh to discuss the results of the recent survey.
Thank you, Susan. So the next section that I'm going to cover is the third survey, and that was administered in starting in March 2021, and that was for care received in calendar year 2020. And as many of you remember, that's when a lot changed in the world. That was the onset of the COVID-19 pandemic. So for our third survey, who participated out of our patient population? So the third survey actually received the largest amount of respondents at over 5,300 patients when compared to the first two iterations. And of our 144 hemophilia treatment centers, or HTCs, across the country, 92% of them participated, or 133 centers. We're going to go in my future slides. We'll go more into depth about the information you see on your screen that overviews the demographics who responded. It is important to note that the information that I'm going to go over does not, and also Susan, that does not include any blank or any responses that checked NA. Okay, go to the next slide. So how do things look when it comes to bleeding disorders, diagnosis, and severity? As you can see on the left side of your screen, the vast majority of respondents for this survey had a diagnosis of hemophilia. And that's actually higher than the overall distribution of population. And when comparing that, we're going to be referencing that to the hemophilia, the HTDS, which is the hemostasis and thrombosis data set, which regional coordinators, or excuse me, regional administrators have HTCs or collect from HTCs every year. So as you can see, it is also important to note that the survey was offered in English and Spanish and was completely voluntary. But when it comes to and on the right-hand side of the screen, you're going to see the severity, and the severe key on the bottom, the lower right-hand side, lists severe, mild, moderate, mild, and other unknown disease. As for severity, mild disease was contained the plurality of respondents, followed by severe disease. This is one of the things that we, as the Patient Satisfaction Steering Committee, are going to be examining going forward to see how severity impacts satisfaction. Next slide. So as you can see, this is more, and this looks into a more in-depth focus when it comes to ethnicity and race. Out of all respondents, 13% of respondents were Hispanic, and then 87% not. Susan's going to go into more details about this across the three different time points. And it is important to note that this is slightly lower than the 17% of patients who are Hispanic that's collected across our HTDS data set. As for race, here's our breakdown on the right-hand side of your screen. It's also important to note that with this survey iteration, the third, this was the first year that the other category was an option. Susan will go over that as well. Okay, and then next slide. Okay, as for age and gender, here's a breakdown. Plurality of respondents on the left-hand side of your screen were age 35 and above. That's 44%, which was much higher than the distribution of patients across our hemophilia treatment centers, which is normally 27% for calendar year 2021. As for gender, 32% were female, and male was at 68%. On to the next slide. So satisfaction with HTC staff, how did that turn out for calendar year 2020? Looking at the percentage of respondents who responded always or usually satisfied with HTC staff, it ranged 97.3% and above, which maintained a very high satisfaction, which is great to see. This was even higher than our 2014 and 2017 surveys. And Susan, at the beginning of our talk, briefly referenced the HTC Comprehensive Care Team, the core team, including, just keep this in your mind, the hematologist, nurse, social worker, and physical therapist. Then you'll see a couple other extended staff, such as the genetic counselor, pharmacy staff in 340B program, as well as nurse practitioner slash physician assistant as well. Next slide. So across gender, race, ethnicity, and age groups, overall satisfaction remained high in 2020 again. This was at anywhere from 88 to 98%, saying they were always or usually satisfied. You can see the legend for the race category on the right hand side of the slide. So this was regardless of any of those categories as well. Next slide. So in terms of teen transition, and when we're talking about that, we're discussing respondents or caregivers for patients aged 12 to 17. Satisfaction also maintained high. And I'll just read the two questions that are, you can see the data is listed on the screen, but I'll read the two questions as they were listed on the survey. So how satisfied were you and your teenager with how HTC clinic staff talked about how to care for their bleeding disorder as they became an adult? 90.9% of those teens said they were satisfied with that question. And then also, how satisfied were you and your teenager about how HTC clinic staff encouraged the 12 to 17-year-old to become more independent at managing their bleeding disorder? And over 92% of those respondents said they were always or usually satisfied. It is important to note that it is a HRSA grant priority to improve healthcare transition for individuals with hemophilia and bleeding disorders across the lifespan. This is also high compared to surveys of other specialty groups as well. We looked at that. Next slide. Okay. And then this slide looks over the HTC processes and services. As you can see, different things were asked. So it also remained high, with each question receiving at least 93% listing always or usually satisfied. I want you to all, again, keep in mind this was during the time of the onset of COVID-19. It's really remarkable what how HTCs were able to maintain this high levels of patient-reported satisfaction. So I'm actually going to read the second from the bottom, the coordination of care, which that's something, if you were to think COVID-19 would be very effective. So how often did HTC staff coordinate care with their how often did HTC staff coordinate care with their primary doctor or other specialists? As you can understand, many clinics experienced disrupted operations. Many went to a telehealth or virtual platform, at least for at least for an extended period. But this was amazing that we were able to see this, and even being easy, the second from the top, being easy to reach when urgently needed. 96% said they were always usually satisfied. So that really is a testament to the hard work that our hemophilia treatment centers that have done across the country in navigating such challenges. Next slide. Okay, so as I stated, many HTCs implemented telehealth starting actually in calendar year 2020. This included in our region too. Many have had it on their, at least on their plans to do so, but this accelerated the rollout for many HTCs. So this was new to many centers, and care was coordinated via a phone and telehealth as well. And in this third survey iteration, we asked a new question about care satisfaction with receiving a telehealth visit. So among our respondents reporting being seen at least once virtually via telehealth visit, the overall satisfaction for the HTC care team members and processes and services was 96% and higher. And again, this is always or usually satisfied. And on the right-hand side of your screen, you'll see a chart comparing individuals with one telehealth visit versus all visits. So it's important to note that if a respondent had at least one telehealth visit, their satisfaction was slightly lower than in comparison to all visits. Next slide. Okay, so we also asked a new question on satisfaction with COVID-19. Was that a barrier for care? So this was new in the third survey iteration, and satisfaction with HTC care team and services did remain high, but and this was even for the we had 14% of total respondents who reported COVID-19 as a barrier, and this would include always, usually, or sometimes being a barrier to care. And of those 14.9 respondents, almost 90% were satisfied with their HTC care, 81% with their HTC team, as well as 75% with their processes. And it's important to note that this was lower than the satisfaction of all patients aggregated together, and that was listed at 97.2, 93.1, and 90% respectively. Now I'm going to turn it over to my colleague Susan Lattimore, who will cover the trends across the 3 survey iterations.
Thanks, Kaveh. So with 3 surveys administered, we've started to compare patient satisfaction survey trends over time. Next slide, please. First, let's look at just who participated across the 3 survey iterations. Consistently, over 92% of all hemophilia treatment centers in the US participated in survey distribution. This means that we received at least one survey from a patient within that hemophilia treatment center. So consistently, those numbers are quite high, even with the COVID-19 impact of 2020. Distributing that survey in early 2021, we still had the lion's share of hemophilia treatment centers participate in the survey distribution. And then you can see on the right side, the patient participation has grown in size from 2014 to 2020. Next slide, please. This shows a breakdown of also who responded across the 3 time points. The 2 bar graphs on the left are showing pediatric versus adult participation. You can see that those numbers are pretty consistent over time. About between 35 and 40% pediatric surveys were received, and somewhere upwards of 60 to 65% the individuals were 18 years of age or older. We saw a slight uptick in the number of people who identified as female who were completing these surveys and submitting responses, over 30% in the 2020 survey administration. Go to next slide, please. And here's a breakdown of from a race perspective. So likewise, reported race was similar across the 3 time points. Just of note, due to the small number of American Indian, Native American, Alaska Native, Hawaiian, and Pacific Islander people who responded as that being their primary race or their race that they were reporting, we aggregated those categories together and combined them in these pie charts. But you can see that the breakdown is quite similar across all three timeframes. Race and ethnicity are areas of further investigation over time, and I think that the relation to satisfaction and the relation to barriers, looking at that through a health equity lens is important, and that work is ongoing currently with the steering committee group to dig into that data. These bar graphs are showing you surveys that are received from individuals identifying as Hispanic, Latino, or Spanish, and those responses have increased over the last survey administration. The number of Spanish language surveys increased just slightly over the 3 time points into 2021. Go to the next slide, please. So HTC satisfactions remained high across all survey time points, and these figures reflect survey respondents who reported always or usually satisfied with overall HTC care received. You can see that this is pretty remarkable, that 97% of the respondents reported always or usually satisfied with the care that they received at their hemophilia treatment center. Next slide, please. In addition, there are consistently high levels of respondents being always or usually satisfied with getting the care that they needed, with the hemophilia treatment center team explaining things in a way that was easy to understand, and with the HTC team spending sufficient time with the patient and family. Again, I just call your attention to the green reflected graphs that are here that are responding from the 2020 experience. That despite COVID, HTC teams were still spending ample amounts of time with patients and families when there was really some constraint on being able to have clinic visits, being able to have time that was available, having some disjointed processes across hemophilia treatment centers, staff being furloughed, staff working remotely and working from home. And so all of those things I think we know had an impact. It's really great to see that patients and families weren't reporting those impacts from a firsthand experience of teams being able to spend enough time with them. Next slide, please. Similarly, did the HTC staff treat you with respect? Did the HTC involve you in decisions about your care? And did the HTC pharmacy program meet your needs? There are consistently high levels of always or usually satisfied across these 3 surveys. Next slide, please. This is just tying into what Kaveh said earlier about adolescent transition to adulthood. He explained these 2 questions that have been consistently asked across the 3 survey time points, and this has been a real area of focus for HTCs across the US. Responses from patients or caregivers ages 12 to 17. Satisfactions remained high regarding care for your bleeding disorder as the patient becomes an adult and becoming more independent and managing your bleeding disorder. And so it's great to see that the work and the effort that's been put at treatment centers to be able to make sure that adolescents are intentionally transitioning to adulthood, that they're feeling that their needs are being met and that they're being prepared for transition to managing their bleeding disorder independently as they become adults. Next slide, please. So this really is addressing barriers. How often was insurance a problem, and how often was language a problem in getting the HTC services you needed? Was asked on all 3 surveys. Reports of insurance always, usually, or sometimes being a problem in getting needed HTC services greatly decreased between 2014 and 2017 surveys. You can see how that went from 30% to 25%, and then even to 16% in the 2020 survey. Much of this coincides with the implementation of the Affordable Care Act and Medicare expansion in many states across the US. And although it decreased from those large numbers in 2014, roughly 16% of respondents still reported that insurance is a problem and getting the care that they need at a treatment center. And this is certainly an area that we need to further explore. We'll dig into this a little bit more deeper as we're going forward to try to understand who's reporting problems with insurance being a barrier to getting care at a treatment center, and where we can understand are there trends that we can be looking at from either a geographic perspective, from a specific diagnosis or age group, and overall, if we can shed some light, I think we can try to see if we can implement some ways to impact this. How often was language a problem getting needed HTC services? Also greatly decreased. Improved access to translators and to translation services likely impacted this over time. There's broad access now at most centers, and really probably at every center, to translator services to be able to help break down language barriers and help improve communication between the treatment center and patients and families. However, we recognize that the survey is available only in Spanish and English languages, so there's a great potential that this number is much larger than we're attributing to the 1.4%. If a patient can't, or a family member can't answer the questions because it's not in the language that they prefer, we're not going to get responses about language being a barrier from that cohort of people. Further analysis of these barriers to care are ongoing, and understanding who's reporting these barriers can help shed a light on health inequities and areas requiring additional outreach or supportive services. Problems related to COVID-19 were added to the 2020 survey, so that data is limited. We only have one survey that was picked up on, but I think that it's thoughtful that we as the steering committee need to be considering how do we incorporate and include world events like this in how they're impacting greater satisfaction with services received, or how it may be impacting the way that care is received and the way that services are delivered. With that, I'll hand it back to Kaveh to discuss what's next with the patient satisfaction survey.
Thank you, Susan. So going forward, looking into analyzing this third survey and beyond into our fourth survey, what's next? Next slide. So now we're looking at using the data, and we're pulling in feedback and conducting presentations such as this one towards our HTCs, regions, partners, and other stakeholders. And we're looking at further analyzing barriers to care and services. And as Susan mentioned in her last slide, we will look at insurance, COVID, and language more into depth, and to see if there's some opportunities for further analysis, especially under the lens of social determinants of health and underserved populations. And are there patient groups with lower satisfaction, and why is that the case? And is that something that we can take forward to us into future survey iterations and as we go forward? And then, are there underserved populations we're not reaching? I know Susan mentioned how the survey is only a limitation that's offered in just 2 languages at the present moment. But then there's also, in comparison with the entire HCC population, for example, Blacks, African Americans, Hispanics, and women are not did not take the survey at the same rates as the entire HCC population. So that could be something we look going forward. And then additional efforts should be made to reach such populations, as broad representation is important. So also we want to look at the importance of satisfaction with the HTC model, and how can we take the success of the 3 survey iterations and bring that to a wider audience. For example, policymakers, insurance, pharma companies who need to really understand the importance of not even just through one time point, but over time, how important the HCC model is to the bleeding disorders population. In addition, many are involved with Washington Days, state legislative days, and also local policy forums as well. My organization, we're a dual regional core center and NHF chapter. We participate in Washington Days and state legislative days. And there are often questions we get asked from just about the experience, and then also how do patients feel about things. So next slide. Okay, so looking forward, like I mentioned, we as a patient satisfaction steering committee will be looking at identifying areas for improvement and needing to reach certain population. Are there underserved populations that are not being reached, and can we promote that along with HCCs to those populations? And then also, as we see, there's a continual emerging healthcare landscape with the HTC model. We're always looking at how can we sustain ourselves, not just today, but going forward with the world just being uncertain going forward. And then on the insurance side, there are always changes in insurance plans, new therapies coming out, as well as, with this survey iteration that looked at the onset of the COVID-19 pandemic and telehealth, how can we tell that story going forward? Next slide. So we as a patient satisfaction steering committee welcome feedback from a wide audience, and the link at the top of your screen is where you can go to find results that we have today. For example, from our posters, one-page briefs, you'll see that we've worked on, and the one-pagers are really good. They go through. It's for a wide audience, and you can see, just really fast. For example, how did things fare in certain areas for adolescents, for telehealth? That's what's been done in the past too. And with posters, we presented at conferences such as the National Hemophilia Foundation Bleeding Disorders Conference, World Federation of Hemophilia, Athens Data Summits, and it's not limited to those conferences as well. So many of you may have seen our first manuscript of the patient satisfaction survey. We're currently working on the second manuscript as well, and that's going to be looking at trends across the 3 surveys. So, and we're always looking at continuing at engaging our HCCs and stakeholders for input on analysis, or if there's certain directions that a broader audience may want to see. We highly encourage you to contact us. I'll go over that in just a little bit. But it is important to note that it's already time, within almost a year for the next survey to come out, the 4th survey. And that's going to be launching mark your calendars in spring 2024. And if any of you have any questions or ideas or any thoughts you'd like to contribute, we encourage you to reach out to us, and it's via the email at the bottom of your screen, the hccsurvey@ucdenver.edu. I think that will be placed in the chat, I believe. So next slide. Okay, so overall, a national patient satisfaction survey administered across the US HTC network remains feasible, and it's supported by our HTCs nationally, and it provides us a valuable snapshot on information of the patient experience from patients and families. So what are our key takeaways that we'd like you to take home with you today? It's not limited to these, but these are the key takeaways as well. So our patients at all of our US HTC network, they reported high levels of patient satisfaction, again, in calendar year 2020. And that's including but not limited to HTC staff, processes, services, and adolescent transition. Next, so this was the first year that we asked about COVID-19 barriers. And for those patients who did reply to that question as having a barrier related to COVID-19, they had a lower overall satisfaction with care received at their HTC. And it is also important to note, and we'll reiterate it again, the great work that our HTCs did with adapting to the circumstances, with care coordination and really listening to the patient needs and adapting to difficult circumstances like Susan had mentioned with furloughs, pay cuts, and disrupted operations. And finally, there's a growing body of evidence from the 3 time points that shows high levels of patient satisfaction, which supports our overall HCC comprehensive care model. Next slide. So we really want to thank all of our hemophilia treatment centers and its patients, as well as their parents and caregivers. Thank you to our regional administrators and directors for really getting the survey out to our HCCs and facilitating all the information, as well as the University of Colorado for data management and the website, and as well as our dissemination working group that Dr. Vanessa Byams is on with the CDC. Also the NHF, HFA, HRSA, ATHN, and World Federation of Hemophilia is on that dissemination work group. Thanks to the Hemophilia of Georgia for translating our survey into Spanish. And thank you to Sean Rice, Dr. Sean Rice, our biostatistician from Oregon Health and Science University, as well as support from HCCs and the HRSA Regional Hemophilia Network Grant and HCC 340B programs. And I finally would like to thank our Patient Satisfaction Steering Committee, Marilee Ashton, Brenda Risky, Rick Shearer, and Virginia Siriana. And it'd be amiss to not mention that this is actually our colleague, Dr. Judith Baker, is going to be retiring very soon, and she's been on this committee since its inception and recruited me, so I owe a debt of thanks as well. And really thanks to our dedicated service, decades of dedicated service to the bleeding disorders community as well. So that's all I have. Susan, Vanessa, feel free to add anything. Otherwise, it's almost time for questions.
Thank you, Kaveh. Thank you, Susan, for that great presentation. So exciting to see this work and this data come to life for this 3rd iteration. We are going to shift to our question and answer section of the webinar. So I just want to encourage you all out there to submit a written question. If you would like to do so, please use the questions area of your toolbar. While we wait for some of those questions to come in, I wanted to ask a little bit about how the survey was administered in terms of how participants were recruited. So I know this was a huge coordinated effort across all of the regions, and we know with several HTCs in each region. So what was the process, or how were participants recruited, whether sort of, in clinic, remotely? How did that work?
Maybe I'll first start by saying thank you again to Marilee Ashton, who is a communication specialist at the University of Colorado Treatment Center. She creates a packet full of information that has, sort of, for better or for like loose terms, advertisement included within it that allows centers to be able to use those tools to work with foundations. The surveys promoted through some of our national partners, NHF, HFA, ATHN have been great partners in helping promote access to this. But the survey is actually very simplistic, for as complicated as I think that we behind the scenes know and feel that it is. The survey is sent to all of the patients who had a two-way contact with the treatment center in that prior calendar year. So a list of patients and addresses is culled. There's a self-return stamped envelope that's included in a mailer that goes out to all of the patients who met that criteria. And then when patients are in clinic, there's often a reminder that this survey is available. Inside the survey, there's also like an administration letter that goes with that just encourages patients to participate and provide their voice, reassures them that it's anonymized, that there are no identifiers that are collected as a part of the survey, why the survey is being administered, and why we're seeking feedback and support. But it's a one-time administration, and we rely on the centers to be able to send it to the applicable patients and families, and then remind people, and then the survey closes and we're done. So it's kind of remarkable that we have 5,300 people who responded through those rather simplistic means, which I think is just a testament to saying patients and families are interested in providing their feedback, and to me, like, that's the best part of all of this.
And just to add to what Susan just mentioned, this is something that, we really try to cast a wide net. We did have a NHF webinar, I believe it was last year, to reach a broader patient population so they could see, as well as chapters. And I know some regions did market this not just to their HCCs, but then also to the NHF chapters. Some had listed it in their newsletter. But kudos again to Marilee Ashton as well, with all the hard work with marketing and getting the letters out. And this year actually saw, this past survey had the highest percentage completed online, where many more were mailed in and completed via paper version.
Such great turnout from the respondents, and as you said, Susan, I think it's a testament to the care. Somebody did ask, and I think you addressed this, Susan, are the surveys de-identified so participants can report candidly without fear of their provider seeing the feedback? And I think that's an important point.
Yes.
Yeah.
You can go online to the website that's posted here underneath the questions and answers to see a full copy of the survey at htcsurvey.com. There's a link that you can go to that says sample questionnaire, and you can see for yourself the questions that are answered, the questions that are asked. I will say that on the post review, when the paper forms are entered, if there are any identifiers that a patient or a family member may have listed in the comments, those comments are redacted and they're not entered into the data set, so that the staff at the University of Colorado that are entering that information they redact and don't enter anything that could potentially be identifiable. So we take good care in making sure that that's the case.
Great. Another question that has come through: do HTCs get a summary of their HTC specific results? And are these results compared to regional and national levels?
Maybe I'll start with this one, Susan, if that's okay. That's a great question, and the answer is yes. So Rick Shearer put a lot of work into this, and we're very thankful to that. He has sent in the past thumb drives, or handed thumb drives to the regional administrators, but then also, if necessary, protected documents that are sent to all regional administrators to send to their HTCs. And yes, they include a comparison from that HTC, as well as how they compare to the region, as well as across the country. So the answer is yes. It is also important to note that there is an Excel file that HTCs can use to do further analysis or look into more in depth with their data, should they choose. And some regional administrators do choose to go over these results with their HTCs as well, to field questions, or if there's anything else to discuss. So.
Yeah, that report provides all of the HTC specific data to that one HTC, and it also has a comparison for all of the data points of a national level, regional level, and that specific HTC level, so they can see sort of a comparator of responses across those three areas.
And one thing I'll add as well is in those reports, there are the HTCs can look at responses that do include no response or NA, or those answers taken out too.
Speaking of comparison, as far as additional analyses that might be done, would you also consider seeing if there are any regional differences in terms of the responses or satisfaction?
Yeah, we've actually done some of that work already. We didn't share it in this webinar, but that work has been done, and we've actually looked at regional differences across the 3 time points. I will say that there was no great finding in that. So I think I can say with confidence that across the U.S. that satisfaction is consistently high, and there are no discernible or significant variations across regions.
We look forward to seeing that further. As you mentioned, Kaveh, I think you guys are working on the next paper related to this data, so that's great. We have a question about, are there any plans to extend this kind of survey to Africa, especially West Africa or Nigeria, or it sounds like, even other countries as far as this type of survey? Have there been any conversations with WFH perhaps, or any thoughts or plans about that?
That's a great question. Virginia Siriano, who's on our steering committee, did present some of the preliminary data from the last survey at the latest WFH meeting. And I know that she was approached by a few people about, has this been implemented in other areas? We would love to talk with people to see if their interest in cross-regional populations, certainly to share the survey that we utilize and see if we can harmonize in some way to provide a better understanding of patient satisfaction outside of the US. And if there's any way that we can help collaborate or work with others, we would love to. That would be fantastic.
We have a question about how does this survey differentiate between the clinical comprehensive care services and the 340B pharmacy, or are these types of health delivery services assumed to be one and the same? Could you
so we do have specific questions on, for example, when looking at the 340B pharmacy, one of the questions, you can look at this there's a copy of the survey at htcsurvey.com. How often did the HTC pharmacy program or 340B meet your needs? But then also, that's actually in a group of questions considered care and services. Also in the care and services, we ask the other questions such as explaining things that were easy to understand, spending enough time as well. And there are a group of other questions, but the specific pharmacy question is pulled out. Susan, feel free to add if you have anything else to.
Yeah, I also wonder, how would you rate your level of satisfaction with the HTC staff? Specifically, HTC 340B pharmacy staff is also one of the team members that we ask questions about satisfaction around. So this was one piece that came up. We made some language change. I'm sorry if I'm not remembering if it was in the 2017 survey or from the 2014 survey, but we did want to make sure that we were very overtly clear what we were asking. That we were asking about hemophilia treatment center pharmacy services or pharmacy programs, not other pharmacy programs that other patients may be using, because we certainly can't report on the satisfaction of using services outside of our own institutions. So we clarified some of that language to make sure that we were being overtly clear about what we were asking. I think some of that's reflected in people saying not applicable. So I mean, we know that not everyone uses a hemophilia treatment center pharmacy program for receiving their pharmaceutical products. But I do think we have 2 questions that are asking pretty specifically about each of those pieces.
We have a couple of questions that are asking about sort of the way the satisfaction responses are reported. I believe with all the metrics, if they are always satisfied or usually satisfied, is there a way or any plans to break down responses so that you could see who is usually satisfied versus those who were always satisfied. And then another related question was sort of being able to look at, those who were always satisfied versus usually satisfied, but not always versus not at all satisfied. So looking a little bit, breaking down some of those gradations. I'm sorry if that was a bit of a tongue twister.
It's always something, that we do keep in the back of our mind, especially as we look to further analysis. I believe if the question's referring to always usually for overall total satisfaction, that's definitely is probably more, I would say, doable at the beginning. But if we're looking at specific questions and stratifying by that, that's always an option, depending on what we're looking at. If we're looking at certain demographics, or we had mentioned the underserved populations, or it's definitely something to keep in mind going forward as we work with our manuscripts and one-pagers and everything else going forward.
Yeah, we've certainly spent some time with looking at who's not satisfied. So not quite as specific to people who are always or usually satisfied, but people who are reporting that they're only sometimes satisfied or never satisfied. And then looking to see if there's any cross section with people who are reporting problems or barriers to care. And that's some of the work that we're digging into now. I think it's hard. I mean, we understand that we can't have an expectation that people are always satisfied. And although that sounds fantastic, I think that that's probably an unrealistic expectation. But I think, to your point, that's a great idea, is really looking at pulling out the people who are always satisfied and really looking at the entire cohort of who remains and seeing, are there other challenges and barriers, or are there processes and services that may disproportionately have a lower satisfaction rating that's seen in that group, and then understanding who's reporting those that decreased satisfaction or those other challenges. It's a lot of data. There's a lot to dig into. I'm excited that we still have a lot of work ahead, but these are great questions.
And then we also have a comment section. Oh, I'm sorry. I was just going to mention we also have a comment section that patients are allowed to comment on their experience, and that's something we may take a look at going forward based on specific comments, or if there's anything that stands out when it comes to that. Some analysis.
I was actually, Kaveh, I was actually going to ask about that, since you have that open-ended question. Have you been able, and I know that can be unwieldy as well, and maybe you'll get to it eventually, but have you gotten to look at some of those text responses and any sort of enlightening pieces there? So maybe still to come.
So I can definitely speak, for our region. During our site visits, we do go over these questions, including any comments. And if there's there always is interesting circumstances, and HCCs can usually understand if it was a unique case, but there's the vast majority of comments that we see are definitely positive. But if there's something with a patient having to wait too long for a medication refill or something like that, or that the HCC can address right there, that's an opportunity. But with comments, you hear everything, so it's it does take time, and it's something we can absolutely look at going forward.
Great. Well, in our last minute or so, I just want to ask both of you, what was the most surprising thing that you guys saw in terms of the results and the findings, especially since how involved you have been in the planning and the dissemination and all aspects, just finally being able to look through that data? What was most surprising?
I would say that I'm surprised that we had the largest number of respondents in the last survey iteration. I mean, it was an incredibly, and remains to be an incredibly trying time, where I would say that a lot of people probably ignore the mail that they receive, or they throw things away or don't leave them unopened. People we know have barriers to accessing technology, and so an online administration isn't for everyone, which is why we also are pairing this still with a paper form. But I'm like, I cannot believe that so many people responded. I think it just really is a testament, like I said, to people wanting to provide feedback, positively or negatively. I'm happy that this community has a voice and that they use it, and they're willing to share their experience.
And to echo what Susan mentioned, just given a lot of the challenges, with certain HCC or with staffing disruptions, or some HCCs had positions unfilled, and just it's a big testament to all the work they put into. And we had some, I don't know, some HCC competitions, but there were some HCCs who really, worked hard to I mean, a lot of our HCCs, they worked hard, but some really collected a high amount of respondents and took this, seriously, and really wanted to feel that feedback from their patient population, which is great to see.
Amazing. Awesome. Well, that is all the time that we have today. I would like to thank you both, Kaveh and Susan, for sharing this information with us. We look forward to seeing more coming from this project, and I would like to thank all of our participants for joining us today. We'd also like to thank our colleagues at Hemophilia Federation of America for hosting today's webinar. Very shortly, you will receive an email asking for your feedback on this webinar, so please respond with your comments. Also feel free to provide any ideas or suggestions for topics for future webinars. We would love to receive that kind of feedback as well. If you have any additional questions about today's presentation, please contact Cynthia Sayers at csayers@cdc.gov. Today's webinar will be archived, and the content will soon be available at CDC's Division of Blood Disorders website, as shown on the slide. So thank you so much, everybody, for joining us, and have a great afternoon. Bye-bye.